dealing with medical board complaints. 2.5 years ago, I sat at the same desk. 2.5 years ago. And I came before you, not for me, but for you. And I said, if they can do it to me, they can do it to you. 2.5 years ago on July 4th weekend, I let the world know that I was being investigated for the first time in my career by the Minnesota Board of Medical Practice. 2 months earlier, I had addressed my concerns regarding how death certificates were completed in days gone by and how modifications had been suggested by the Department of Health and the CDC. And I told you then, if they can do it to me, they can do it to you. Less than 2 days ago, I received a packet. This time it's not just from the Minnesota Board of Medical Practice. This time the Office of Minnesota Attorney General Keith Ellison is involved. The byline on the stationery: helping people afford their lives and live with dignity and respect. In this document, I've been advised that the 5th investigation will require hearings, meetings. The first 4, this is number 1, this is number 2, this is number 3, this is number 4. These, the allegations were dismissed. But this 5th one, and now there have been a bunch more added. And I'm going to share them with you. Before the Minnesota Board of Medical Practice, a notice of conference. The Attorney General's office will provide the legal counsel for the Minnesota Board of Medical Practice. I was up till after 1 o'clock this morning trying to go through this. Folks, let's be clear. This is all about raw politics. This is about raw power. This is about punishment. This 5th investigation started 15 months ago. The entirety of 2022 had no engagement. What do you think happened in 2022? I think you probably know. The pieces of the puzzle fell in place. Now there's an opportunity for dissenting voices to be crushed, literally extinguished. I'm going to say it again. If it can happen to me, it can certainly happen to you. It can happen to any of us, whether we're talking about censorship on Twitter or whatever else. To my knowledge, not one of the allegations against me has had anything to do with patient-doctor care. It has things to do with someone didn't like the way I listed my position as clinical associate professor on my curriculum vitae. Someone didn't like the idea that I promoted the benefits of natural immunity over vaccines. Someone didn't like it that I compared, like Tony Fauci did and Mike Osterholm, the influenza to COVID. I'm going to be posting these. You can see what this is about. But make no mistake about it. At a gut level, this is about Dr. Scott Jensen, having taken care of patients for 40 years. His license is on the line. How does that make me feel? Sick to my stomach. I will be up after midnight for the next days and weeks as I prepare and look through my notes. I don't even know what to tell you. I think that what we should be focusing on, instead of trying to extinguish a voice of skepticism, I was the vice chair of the Health and Human Services Committee in the Senate. I was the one that Tim Walz called and asked, could I come over to his office so we could get an insulin bill passed? I was the one who took the pharmacy benefit managers to task and got that bill passed so that they would be registered and licensed. I think we should be talking about what I talked about in my book, The Triad of Tyranny. I think we should be talking about what happens when big tech and big pharma and big government come together and want to crush you. What do you think happens? You get censored, You get kicked off social media platforms. You get shadow banned. I said in this book that we've all been played, and we have. I wrote a book 8 years ago, and in that, Relationship Matters, I said this. This is 8 years ago, prior to COVID. Skyrocketing premiums, providing less coverage, big business maneuverings, expanding government intrusion, entitlement programs running short of funds, increasing costs associated with dying, and risky interventions threatening the patient. All these elements serve to create a combustible medical milieu with the fuse already lit. Well, 36 hours ago, when I opened my letter from the Board of Medical Practice in the Attorney General's office, and found out that they're not done with me yet, I just have to tell you, there is a lot of supporting evidence that you could look at and see how wrong this is. At the end of the day, this is about crushing the skeptical narrative. If you're not getting on board, you're a problem. So I'm going to be as transparent as I can. You're going to see exactly what has been alleged against me. Over the next 2 or 3 months, I will meet with the Minnesota Board of Medical Practice, and I will meet representatives of the Attorney General's office. I want to be fair. I understand the Minnesota Board of Medical Practice has a very real mission. But this is not about a physician providing inadequate services to his or her patients. This is not about a physician engaging in some unprofessional behavior. This is about a family doctor who's been a faculty instructor and associate professor at the University of Minnesota, teaching students, medical students and residents for years, taking care of patients for decades, who sat on as vice chair of the Health and Human Services Committee for 4 years, who ran for governor, who spoke to policy issues, who said, we can do healthcare better, we can do inflation differently, we can take on education differently. I have made thousands and thousands of comments, and here I am. Is my medical career going to be truncated, cut short? What will be, will be. But make no mistake about it. If they can do it to me, they can do it to you. And they're doing it to me.